Welcome back. It's time for our health report, and joining us now is Africa 54 health correspondent Lino Mudo with more news on the Zika virus. Lino.
The World Health Organization has issued a warning that the international health community is not ready to tackle the Zika virus and must find a common response to the public health emergency. Scientists and experts in public health regulations, research and development gathered in Geneva yesterday to assess the progress of vaccine development, diagnosis methods, and other preparedness measures. Fear of the Zika virus is gripping the world, and particularly Latin America, as Brazil deals with an outbreak while preparing to host the Summer Olympics. Brazil has confirmed more than 640 cases of microcephaly and considers most of them to be related to Zika infections in mothers. Marie-Paul Kieni is WHO Assistant Director General for Health Systems and Innovations.
So after we've struggled with Ebola and we said never again, we should be ready. There should be R&D preparedness. We must work on having tools, vaccine, diagnostics that are quite advanced on the pathway to registration. And here we are again, and we are not prepared. And we hope that the result from this meeting will be an identification of which are the most promising products, drug, vaccine, treatments, vector control methods, or medical countermeasures, or as our friend in Barda called them, and will help all of us to make sure that we invest in the right strategies in order to do something quickly for what seems to be a real public health emergency.
Now the evidence gets stronger every day that the Zika virus causes microcephaly, a serious birth defect when pregnant women contract the virus. VOA's Carol Pearson reports on a groundbreaking study that found a likely biological link between the virus and the birth defect.
This is the laboratory at Johns Hopkins Institute for Cell
tower that scientists at the Uganda Virus Research Institute were using in 1947 to research yellow fever when they isolated an unknown virus in the blood of a rhesus monkey. That virus, Zika, is now surging through Brazil and other parts of the Western Hemisphere.
It was isolated here, and a lot of work has been being done in this forest. Because if probably it wasn't done here those days, either it wouldn't have been known up to now, or it will be like a new disease. But the good thing is that it was known before, and it wasn't really starting from scratch when this outbreak started.
Scientists here have discovered 27 viruses in 224 species of mosquitoes. They've worked on roughly 80 viruses, including Ebola and West Nile virus, once obscure illnesses that have become global threats thanks to air travel and urbanization.
You know, viruses, diseases don't observe boundaries. They can easily say from Sudan or Zambia or Uganda. They may be here today, but a few years to come, you may find them in the United States, in Europe. So we should all be concerned.
The symptoms of Zika virus are usually mild, so people haven't been that concerned. Until now, amid reports that Zika could be sexually transmissible and that it could have mutated to cause the birth defect microcephaly in newborns. Back here in Uganda, researchers say that with proper funding, they'd be happy to look into it. Jill Craig, VOA News, Entebbe.
And that was the Zika research in Uganda. Zika was actually discovered decades ago by scientists in a small forest outside the Ugandan capital, Kampala. And now the evidence gets stronger, as I mentioned earlier, that there is a possible link between Zika and microcephaly. Here's a report by Carol Pearson.
This is the laboratory at Johns Hopkins Institute for Cell Engineering in Baltimore, where scientists worked around the clock for a month to find out how the Zika virus affects brain cells.
In this study, we just asked a very simple question. What are the cells that are preferentially vulnerable for the Zika virus?
Since last year, When the Zika outbreak started in Brazil, more than 5,000 babies have been born with abnormally small heads and the possibility of severe developmental delays. The condition is called microcephaly. What these babies have in common is that at some time during pregnancy, their mothers were infected with the Zika virus. Since then, scientists have tried to determine why and how the Zika virus affects the developing brain and when the fetus is most vulnerable. At Johns Hopkins Medicine and Florida State University, researchers looked at what happens when the Zika virus is put in a petri dish with lab-grown cells of the type that form the human brain. These are stem cells and the more developed neural progenitor cells. The researchers found that the Zika virus reacts in two different ways.
First, they will kill some of these neural stem cells that are responsible for forming part of the brain, and also it will slow down the growth of these neural progenitor cells if they're not dead yet.
They also found that the virus co-opts the cells and uses the cell's ability to reproduce to make copies of itself. Ming says more work needs to be done to prove that the Zika virus is directly responsible for microcephaly. That work would involve a similar study, using a three-dimensional model that is closer to the way the brain actually develops. The scientists from both universities are now collaborating on another study.
Another thing we really would like to do is to see whether we can find ways to block the Zika entry or the action of Zika virus on these cells.
Blocking the virus or finding a way to keep it from damaging brain cells would make Zika far less threatening than it is now. Carol Pearson, VOA News, Washington.